Why is a biopsy essential for early stomach cancer staging? Imagine trying to solve a puzzle without seeing all the pieces. That's similar to diagnosing early stomach cancer without a biopsy. Staging is like mapping out how, for the cancer has spread inside the stomach and beyond. It helps doctors decide the best treatment and gives an idea of what to expect. But to do this accurately, they need concrete evidence, and that's where a biopsy comes in. Early stomach cancer often develops quietly, with few or no symptoms. This makes it tricky to detect early on. Imaging tests like CORT scans or barium swallow tests can suggest there might be a problem, but they can't confirm cancer with certainty. Only a biopsy can do that. During an endoscopy, a doctor inserts a flexible tube with a tiny camera into the stomach. They take small tissue samples from suspicious areas. These samples are then examined under a microscope by a pathologist who looks for abnormal or cancerous cells. Confirming the presence of cancer is the first step. But a biopsy also reveals what type of stomach cancer it is. Some types have specific features or markers, like HER2 or other proteins, which can influence treatment choices. Knowing these details early helps doctors plan personalized therapies that are more likely to work. Beyond diagnosis, the biopsy provides critical information about how deeply the cancer has invaded the stomach wall. It also helps determine if nearby lymph nodes or tissues are affected. This information is used to assign a stage based on systems like the TNM classification, which considers tumor size and spread. Early-stage cancers are usually limited to the inner layers of the stomach, and detecting these early changes is vital for successful treatment. In some cases, precancerous conditions like intestinal metaplasia or atrophy can be identified through biopsy. These are important because they increase the risk of developing stomach cancer later. Accurate sampling from specific areas, such as the incisura angularis, improves the chances of catching these early signs. Missing these can lead to understaging, where the cancer appears less advanced than it really is, potentially leading to less aggressive treatment than needed. In essence, a biopsy is the only way to definitively diagnose early stomach cancer, determine its exact type, and understand how far it has progressed. Without it, doctors are essentially guessing, which can lead to missed opportunities for early intervention. Early and precise staging through biopsy allows for timely treatment, which is especially important because stomach cancer often doesn't cause noticeable symptoms until it has advanced. Remember, always consult healthcare professionals for personalized advice, as each case is unique. A biopsy provides the critical information needed to give patients the best chance for successful outcomes and better quality of life.